He is completely unresponsive. He has a hole in his skull and his brain is exposed. Mark and Colin know it's down to them and the crew to get him to hospital alive.
We have a cyclist being struck by a car, one patient. The patient is fitted with massive head injury. So if you could leave all resources running, please.
An ambulance has been dispatched, but there's a high chance the cyclist has a significant head injury. Critical care paramedics Aidan Brown and Ryan Ferris have been scrambled.
The initial reports that came through that he's unconscious and having a seizure. Likelihood that he could be a very unwell gentleman with quite a significant head injury.
Reports of the cyclist's condition is so serious, a trauma doctor has also been dispatched.
We've got a run time of 1 minute.
When they arrive, police and paramedics are already on scene.
Hello, good morning, good morning. Hi, I'm Ryan, one of the CCPs.
Hi, bud. We have a cyclist. He's very irritable now. He's got a nasty wound.
Was there any sort of active seizure activity on your arrival?
Yes, he's fitted.
He's fitted, has he?
I need you to keep still, darling.
All right, sir.
Try and relax for us. We've got you.
The 22-year-old cyclist was on his way to work when he crossed a busy junction and was hit by an oncoming car. The force of the impact threw him into the windscreen and he landed on the road.
Has he got a blown pupil?
No.
No, that's fine.
He wasn't wearing a helmet. Ryan's initial examination indicates an extremely reduced level of consciousness and a life-threatening brain injury. Although unconscious, he's fitting and at risk of making the injury worse.
If you're happy, I think what we'll do, we'll sedate him a bit, get him relaxed.
Yeah.
We'll get him scooped onto the stretcher and we'll potentially just prepare in case he needs an anaesthetic and we'll get him off to sleep.
Aidan quickly prepares ketamine, a drug carried especially by the critical care team to calm him down. The man is so seriously injured, he needs to be put into a coma. But there must also be a trauma doctor present to administer the anaesthetic.
I'll tell you what, let's get a bandage over that cannula as well. That's fine. All right, guys. This gentleman's going to go off to sleep. Okay, so just to make you aware, we're going to just prep, get him on there, and then we're going to give him an anaesthetic and set him off to sleep. All right.
While they wait for the doctor, Ryan and Aidan prep for the complex procedure, one that's normally only carried out in hospital.
So what we'll do, the obs are on. We'll get that on a 3-minute cycle, if you don't mind, please.
The cyclist is still in a very unstable and agitated state.
Have you got the ketamine still?
Yeah.
His blood pressure's fine. He's starting to fight us a bit more. Are you happy if I go for another 20?
Yeah.
Guys, just going to give him a little bit more ketamine, all right, just to relax him.
Thank you. Have you got a rough ETA, please? ETA is 0.8 minutes.
Aidan checks the ETA of the doctor.
Just for your information, the patient is packaged on a scoop. We are fully prepped for an RSI, so we're ready on your arrival or received.
Any delay could be fatal.
It's cold by the looks of it. Somebody's having a right panic. You need to get somebody in straight away. Can you hear it going on? He's bleeding or he's being sick. Whatever it is, it's not looking good. Can you hurry up for the ambulance, please?
The patient is in a life-threatening condition. He's deeply unconscious, and the ambulance crew already on site are struggling to get oxygen into him.
What they're reporting is trismus. Essentially, the jaw is locked, which means that the patient may not be able to get enough oxygen to the brain. As you're probably aware, the brain can only survive so long without oxygen before you have irreversible damage.
What's going on?
This is Julian Grizzly, assaulted in the head.
Yeah.
Also positive yesterday.
Yeah.
32-year-old lorry driver Julian was on a night out when he tried to intervene in a fight. He was punched and fell to the floor. He's now fighting for his life.
Whether CPR was started or not.
Yeah.
There's a lot of commotion.
Yeah.
His right ear has got serial amounts of congealed blood. Pupils, left side sluggish in 3s,
Yeah.
right side was reacted in 3s.
Julian is completely unresponsive and bleeding from his ear. All the indications are he has suffered a traumatic brain injury.
was trismus. We couldn't get an APA in, so we popped an MPA in on the left-hand side. Stats were 92 on air, they're now 100% on 15 litres. Got bilateral access. He's been blood pressure stable throughout, and we've given him 1 gram TXA.
Brilliant.
Julian's jaw has locked, so the paramedics have inserted a tube through his nose to get vital oxygen into him and keep his heart and other organs functioning.
Looks like gentleman's been assaulted and it seems deeply unconscious at the moment. So Ravi's just going to assess him, but we may just travel as we are because we're not that far from the hospital and reassess on the way.
You might as well tell him to get ready.
Yeah.
Julian needs all the skills and resources of a major trauma hospital. As the Queen Elizabeth is just 10 minutes away, Ravi decides this is the best option.
Hi, it's Ravi. So can you just put a quick alert to the QE to say that we're going to be there in a couple of minutes with a GCS3 head injury, observation stable, and have anaesthetics on standby. So we're not going to RSI here, but you'll probably need us. Okay, cool. All right, so bye.
Having updated the trauma desk, Ravi monitors Julian closely throughout the journey, while Richard follows the ambulance, ready to help should his condition deteriorate further. At the hospital, Julian is taken straight into the emergency department for ongoing trauma care.
It's difficult with these conditions and these incidences to determine what the outcome's going to be. Because I work in the intensive care setting, this is something I see quite regularly, and there are people that come in very unconscious that wake up and walk out of hospital 12 hours later. And on the other end of the spectrum, you've got somebody that's severely disabled that needs care for the rest of their life. Until the hospital have done the scans, they've given him some time to recover, we won't really know what his outcome's going to be.
It's unclear if the driver has suffered a cardiac arrest and crashed his car, or his injuries are so severe that he has lost consciousness. Either way, he needs urgent critical care.
Paramedics, please, some fire to my location.
Sounds a bit panicked.
After whiskey 55, just confirm, 3-star onwards.
As the other emergency services converge on scene, Mark and Colin must brace themselves for what they will find.
No, it's on scene.
Roger that, mate.
So there are cars in front of this thing. Just be aware there's people there. Yeah.
Arriving at the crash site, they discover the ambulance crew have managed to get the man out of the badly wrecked car. The dashboard is completely crushed and the horn still blaring.
Guys, do you want to give some space so we can work with it, yeah?
A large group of passers-by have gathered.
Mine across the car, GCS3.
Okay.
So we've whipped tonight.
Cheers.
Got a massive heading.
Right, okay, yeah. Okay, cool.
The 38-year-old man was driving back from seeing a friend when his car left the road and hit a wall.
Thanks for your help, guys. Just move that way.
He is completely unresponsive. He has a hole in his skull and his brain is exposed.
Don't worry about the collar, guys. We're gonna put a tube down him and go from there. Cool. You want to do drugs and yeah, cool.
The man's breathing is so faint, his heart could stop at any moment. Mark's only option to try and stabilise him is to put him into an induced coma so he can take over his breathing.
From our point of view, we can do it here. I think we've got enough space here, haven't we?
Yeah, we do it here.
As they prepare to perform this major life-saving intervention,
Guys, is there... I know he's got the wound on the one side of his head, but there's nothing on the other side, is there? Mark, they nearly got him strapped on, so we might as well just lift him up onto
Fine, mate. Yeah, absolutely fine.
Mark and Colin know it's down to them and the crew to get him to hospital alive.
Cole, you can just stay there and just rotate round, can't you? Cole, so I'm going to do ketamine, sucks, and some rock afterwards, and then we can go from there. And he's pretty fast at the moment. We're going to be
Literally going straight up there, and then we're gonna put a tube down him and go from there.
The patient could die at any moment. So Mark, a consultant anaesthetist at University Hospital North Midlands, is going to place him in a medically induced coma so they can control his breathing and protect the vital supply of oxygen to his brain and organs.
Cole, you got the VL?
Yeah, it's all ready.
I'm just going to do a mental check through. So scope, yeah. Tube, you got a bit of gel in it? I just need a bit of syringe in the end. There's the KY.
Succinylcholine and rocuronium are two fast-acting muscle relaxants that will temporarily paralyze the man's muscles. A mechanical ventilator will then breathe for him.
Just pop them on his chest for now. We don't need them taped in. Are you ready to lift and come onto here? So just come round and spin round. Yeah, head there.
With the help of one of the bystanders, an off-duty paramedic, the crew lift the man onto the stretcher to carry out the procedure which is normally performed in a hospital.
Get more free. Hold on, just take. Left foot. You happy at the top end? Yep. Good.
Put a blanket over his chest if we can. Have we got access yet? We need 2 lots of IV access then.
Let's have a look at his eyes.
In the dark, by the side of the road, Mark can't afford to make any mistakes. So before he administers the powerful drugs, he checks to see if there's been any change in his condition.
Definitely eyes 1, verbal 1, and then it's just motor is varying. As if anything, he's doing abnormal flexion, isn't he? Right, monitor eyes, just want to look at the monitor. So just run back on. So we've got ECG on. I'm about to try and do blood pressure again because we've not really seen one at all.
He's a bit cold, isn't he, unfortunately?
Just doing a blood pressure at the moment. Is he fighting on that arm, or is it just...
Yeah,
Trying to take the mask off, I think.
No, just think about the blood pressure, why it's going...
The man's condition is deteriorating. He has an irregular heartbeat and low blood pressure.
I think we're going to have to work pragmatically on what we've got, Cole. Right, it's struggling with the erratic rates. He's going to do something very strange with us in a minute, Cole.
Yeah.
He could go into cardiac arrest at any moment. They need to act fast.
Guys, for those of you who haven't seen him before, in a minute he's going to have a bit of a twitch as the paralysis kicks in. I'm going to pop the tube down. Okay. Right, ready. Time check. You happy, Cole?
Yeah.
Yep. Quarter to 2. Yep, quarter to 2. Yeah, I think everything's very cold. It's a heart. Right, this is going to be a token 50.
As the drugs kick in, the muscles in the man's arms convulse. He is now completely paralyzed, unable to even breathe for himself.
Okay, all yours.
Colin now has 5 minutes to get the breathing tube in place and start ventilating him, otherwise he will die.
It's epiglottis, grade 1. Yeah, already?
Yeah, he's got just a large epiglottis.
Okay, boogie's through.
Yeah,
ready for the tube?
The effect of the paralyzing drugs lasts for less than 30 minutes, so it will need constant monitoring to avoid any conflict between his body's natural breathing and the ventilator.
Just hold the tube for me, mate. We'll go with 820 at the teeth.
Okay, got the tube. Yep, tube. Bougie out. Okay, right. Again, yeah, got good movement. Okay, I'm coming off the cricoid. I'm going to give him some rock because I can feel him moving already.
Colin will squeeze air into his lungs manually until he can be attached to the ventilator.
The rock's in. Okay, happy?
Yeah.
If we can start wrapping him up. So have your fluids at the top there, aren't you? Yeah. So let's start keeping the warmth in if we can do. Suction can come away.
Yes.
Right, happy there, Cole?
Yeah.
Thank you.
Yeah, thank you.
Guys, anyone seen anything we've missed? So we're happy, airway secure, we're breathing nicely.
We are.
Okay, Sats are still very erratic. I don't think we can make any comment on that at the moment, it's too cold.
Right, we'll get him on the ventilator as soon as he's in the back of the ambulance then. You ready?
Mark and Colin will travel with the patient to provide critical care throughout the journey. 15 minutes out, Mark administers another dose of the muscle relaxant combined with a sedative. Arriving at hospital, time is critical. The man is taken directly to the emergency doctors.
That patient there The longer he went without his airway being protected and us controlling the oxygen and the carbon dioxide levels, the more damage that potentially could happen to his brain. And what we hope is that by doing that early intervention, a good 45 minutes before he got to hospital, we hopefully helped stabilise him a bit and made a difference.
They're having to assist his breathing, otherwise he stops breathing. So what happened? He basically went over the handlebars on his mountain bike. He's landed on his head. His face landed on his head, okay. Is he conscious? He's not conscious, no.
With the man unconscious and struggling to breathe, this is a Category 1 emergency, the highest priority.
No, go ahead.
An ambulance, the air ambulance, and the critical care team have been dispatched. The injured man is in a remote forest location. 2 critical care doctors, who also volunteer for the Mercia Accident Response Service, have also gone to help. A serious traumatic head injury could cause anything from a fractured skull and seizures to a life-threatening bleed on the brain, requiring immediate emergency surgery.
All clear ahead and taking off.
So Helimed 06 from Cosford has also been scrambled.
Who's on 6 today, out of interest?
Jules and Becky.
Got my FFP3 mask and helmet, which I happen to have with me. And in theory, I could jump on and fly the patient with the 6 crew.
Brilliant, that's great, thank you.
Dr. Richard and Kerry are now only a few minutes away, but fast A roads have been replaced by narrow country lanes.
Here we go. Take it steady down here then. It really is in the middle of nowhere, isn't it?
It's right next to a big kind of wood. Obviously, it's been mountain bike and there's been some trails out here. There we are. Hi, that's not 8 on scene, over.
When they arrive, an ambulance crew and the Helimed team are already on scene treating the patient, along with critical care doctor Katie White. The mountain biker was in a very agitated state, which indicates he may have a serious brain injury. He's now been put into an induced coma to prevent further damage to his brain.
So I'm going to jump on the aircraft and fly the patient, because obviously we work on the aircraft. So that just means we can get him to hospital quicker, get the treatment he needs, basically.
Nice and steady.
Before they take off, Dr. Richard provides the hospital trauma team with an update on the patient's condition.
We're bringing you a trauma patient by air, each hour approximately 25 minutes from now. It's a 37-year-old male who's come off his mountain bike at about 6:30 and was witnessed to be unconscious.
Even on blue light, the journey by road to Bristol South Meads Hospital would take well over an hour. By air, Dr. Richard and the team will cover the 60 miles in just 30 minutes. Just a few minutes into their shift, critical care paramedic Alistair McNeil and Dr. Ali Hussain receive a call-out.
So the details are a bit unclear, but it sounds like as if there's been some sort of car accident. And they're receiving.
It is a 18-year-old female pedestrian versus car. Patient has a head injury with a GCS of around 14 and closed left femur, significant bullseye to the windscreen.
A bullseye is the characteristic smash left on a car windscreen following a head impact.
Yeah, that's all received, mate. Turns out it's an 18-year-old girl who's been hit by a car and has got a head injury, but she's also broken a thigh bone, which is a very strong bone. Then says head injury, thigh bone, God knows what else is going to be injured in between. Then there's a lot of softer, more fragile stuff between the head and the leg. So for all intents and purposes, at this stage, it could very much be a life-threatening injury until proven otherwise.
The accident has occurred on a quiet residential road. Damage to the car shows the force with which her leg struck the bonnet and her head the windscreen.
Beth, do you understand what's going on right now?
Yeah.
Yeah. Yeah, unfortunately. Do you remember?
No. Can't remember what's happened.
Yeah.
Beth has no recollection of the accident and may be concussed.
Working my way down, chest is clear, abdomen clear, we're into the femur here, but there's a lot of pain.
Beth's thigh bone is also clearly broken.
She's saying she can't feel the leg, but when I'm testing sensation and stuff, there's full sensation down there.
Perfect.
It's a serious injury which needs to be treated swiftly, as it can lead to dangerous internal bleeding or blood clots.
Any chance you could be pregnant at all?
No.
Good. If you take a big breath for us, really, really big. Any pain in the chest?
Just my leg.
Nothing in your tummy?
No.
That's fine. Beth, so you've broken your leg, and so far, thankfully, doesn't look like anything else. We're going to give you some strong painkillers and pull your leg straight.
Pulling a broken leg straight helps reduce the risk of complications, but it's a painful procedure.
It might hurt to start off with, but honey, look, because of the way the bone is right now, if we pull it straight, the muscle won't spasm and it won't hurt as much. A little bit of pain now, we'll get that sorted.
She can have more morphine, can't she, if she's only had 5, so have that.
I'll give that now.
Yeah. We're getting you some stronger painkillers, but once the leg's a bit more straight, it'll stay straight like that for a long time. It'll be more comfortable once you get to hospital as well, all right?
Dr. Ali is going to stretch the leg out using a traction device. It's a notoriously agonizing process.
We're going to get you to start to breathe on this gas and air. Do you know how to use it?
Yeah.
Like a scuba diver? Grab a hold of it with this hand, and then real deep breaths to pull it into your tummy, all right? And then we'll pull your leg straight in about a minute.
Entonox is a pain-killing gas that acts quickly, which along with the morphine will help Beth to cope with the procedure.
Okay, it's going to be sore, so you need to just nice and slow. Big deep breath, inflate it like a balloon, and out. Good. Slow and out. Excellent, doing magic. Right, I'll come to the bottom end. Oops, sorry.
Traction is applied with a metal splint and straps which pull on the leg.
It's going to be okay. Stay still for me. Stay still.
There, big breaths. Right, tension coming on.
It's okay. It's okay. Keep going on that.
Pull it next. Okay. On now, darling.
Give me your hand, sweetheart. Give me your hand. You okay?
There we go. Right. There we go.
Okay.
All right, darling.
Beth's femur is now realigned.
Beth, can you lift this leg up for us? Lift this leg up.
Lift this leg.
Okay, just try a little bit for me. Just need to know if there's any pain in your hip.
Dr. Ali wants Beth to raise her other leg to make sure her pelvis is intact.
That feel all right? If I push up, does that hurt?
It hurts.
It does.
Is that painful?
But Beth's struggling to communicate.
Slow it down, honey. Slow it down.
Slow
Does she
breath.
need it?
Stay down for me.
Beth, ease it up, ease it up, ease it up. Beth.
Beth.
The Entonox gas has left her confused, and now she's taking too much.
Come on.
Beth, slow it down.
Beth. Come on.
Without being aware, Beth has managed to raise her left leg.
Well, she's flexing it, isn't she?
It's a good indication her pelvis isn't damaged.
Cool.
You okay?
Beth, honey, how you doing? Yeah, that's going to be the Entonox you've taken a bit too much of, the gas and air, but that's fine. That's not a bad place to be honest.
Satisfied Beth has no further injuries, Dr. Ali arranges for her to go to the local trauma unit. As her condition is no longer judged to be critical, Beth is left in the care of the ambulance crew.